Thank you for that kind introduction. I'm Dr. Michelle Dossett, and it's a joy for me to be with you today and share about mind-body medicine and these tools for a well mind and body. Just by way of disclosures, I don't have any relevant financial interests, but I have been practicing meditation for over 25 years and teaching these skills to individuals for over a decade. And so while most of what I'm going to be sharing with you today comes from the scientific research and literature, there's also pieces here that are informed by my own personal practice, my interaction with teachers who've been doing this for 10 and 20 years longer than I have, and also from the thousands of patients that I've worked with. So today I'm going to talk about mind-body medicine and how this can be a useful tool for mental and physical health. And I'm going to start by sharing a little bit about the current state of health in the United States. Then I'll share some data on how meditation improves well-being, and we'll end with some practice and how to integrate this into your life. So no surprise to anyone that mental health is a big issue in the United States. This is data from the CDC, and you can see that in 2021, over the past year, overall, almost 23% of the US population had some kind of mental health issue or mental illness. Slightly more predominant in women compared to men, in younger age groups compared to older age groups. You could see that the percentage varies across race and ethnicities, with the highest being among those who identify with 2 or more races. Now, these numbers are not just a reflection of COVID. While they're certainly higher than they were pre-pandemic, they're only a few percentage points higher overall. And physical health issues are also a major issue in this country. 60% of the adult US population has at least one chronic disease, and 40% has 2 or more chronic diseases. And you can see a list of some of the most predominant chronic diseases there at the bottom of the slide that not only shorten lifespan, but also cost the US healthcare system a tremendous amount of money. And many of these diseases are preventable through lifestyle changes and are impacted by stress, which we'll talk about. 70%, almost 70% of the US adult population aged 40 to 79 use at least one prescription medication, and almost a quarter of US adults take at least 5 prescription medications. Now, a lot of this is related to lifestyle choices, but stress is also a big contributor. And as you look here at this graph, this is the top 25 most stressed countries in the world in 2022, according to a Gallup Global Emotions report. And the United States ranks number 13. And if you look at our company along this list, it doesn't look very great. In fact, the only other sort of peer nation that you see on this list is Canada at number 24. It's been estimated that 60 to 90% of visits to primary care physicians are in some way related to stress. And stress is ubiquitous in our society and a major contributor to the burden of chronic physical and mental health conditions that we see. And I want to share more about that. But first, let's just look at the physiology of stress in the body so we can understand how this works. All of these events, major life experiences, both good and bad, losing a job, getting married, losing a loved one, traumatic experiences, and just the little niggly day-to-day stuff in our home and work and neighborhood environments. All of these stressors get perceived by the brain and processed through the same evolutionarily conserved pathway. And depending upon our genetic endowment and environment, we have a set of behavioral responses and physiologic responses in the body, things that our body does to try to maintain homeostasis in the body. And that response of our physiology to try to keep all of the different parameters, our pH, our electrolytes, and heart rate and everything within a certain range, creates what's called an allostatic load. Now, we need this stress response, and here is an example diagram of a normal stress response. On the x-axis, you see time, and on the y-axis, you see some physiologic parameter. This could be heart rate, it could be blood pressure, it could be release of cortisol in the body. You have some stressful event, and this response comes up and then comes back down to normal over time. And this is a normal stress response. We all have this. We all need this. We've all thrived on this a little bit to some extent. Where this becomes problematic is living in the 21st century, as you see in A in this graph, where we get repeated hits of the stress response over a short period of time. And this is what can lead to wear and tear on the nervous system. Now, what we would hope would happen is, as you see in B in the gold line, where the brain would say, oh yeah, I've seen this before, it's going to be okay, I don't have to worry about this. And you don't get these repeated high hits of the stress response. But that doesn't always happen. If we have lack of adaptation, as in B, or C, a prolonged elevation of the stress response over time, these can lead to wear and tear on the body and the brain. And over time can lead to the situation in D where you can mount an inadequate response to the stressor, and that also is problematic. Now, when the brain perceives these stressors, it signals the nervous system in the body to activate the adrenal glands to release glucocorticoids such as cortisol and other mediators such as epinephrine and norepinephrine that then travel throughout the body and interact with receptors in all of the major organ systems in the body. And so, as part of our stress response, these stress hormones send signals to our cardiovascular system, increase heart rate and blood pressure, to the gastrointestinal system, affecting motility, secretion, absorption, and also the production of neurochemicals like dopamine and serotonin, and also interact with the immune system, causing the immune system to release inflammatory cytokines and chemokines that also then have effects throughout the body and feedback on the brain. So now let's talk a little bit more about how stress impacts the brain. But I want to start first with image A here in this slide, in the alert, calm, non-stress state. When we're in this state, the prefrontal cortex in the front of the brain is what's calling the shots and telling the rest of the brain and body what to do. This is the part of our brain that's involved in concentration, attention, planning, decision-making, all of our executive functions. In contrast, when we're stressed, as you see in B, the amygdala, the center of our fight or flight response in the middle of the brain, gets activated. And the amygdala does several things. One of the things that it does is to inhibit the prefrontal cortex. This is why when we're really stressed, sometimes we can't think clearly, or we have just a lot of thoughts that rush through our head. The amygdala also activates parts of the brain that then result further in the activation of the autonomic nervous system and the release of epinephrine and norepinephrine all through different parts of the body. And the amygdala also activates certain areas of our brains that are involved in our reactive and habitual reflexive responses to things. This is why some people stress eat, or some people, when they get stressed, lash out in anger, for example, or any of the other behaviors that you may notice as a result of your stress response. One of the key findings from the research is that the prefrontal cortex is activated and strengthened through meditation practice. And so meditation can help bring the prefrontal cortex back online in the face of stressors. So let's talk a little bit more about meditation and mind-body techniques and what I call mind-body medicine. Mind-body medicine uses practices that take advantage of the interactions among the brain, mind, body, and behavior with the intent to promote health. And this includes a wide variety of practices. Meditation is the sort of central or most studied practice, but it also includes certain breathing techniques, yoga and Tai Chi, for example. So the use of meditation and yoga and mind-body techniques in the United States has really increased dramatically over the last 2 decades. And what you're seeing here is data from the CDC collected in a survey of U.S. adults in 2017, and this is the most recent published data that we have. And what you see in the graph on the left is the frequency of U.S. adults, men and women, who had tried meditation or yoga in the past year. And so 16% of U.S. women and almost 12% of U.S. men had tried meditation in the past year. Those numbers are a little bit higher for yoga for women, a little bit lower for yoga for men. In terms of the age spectrum of who's doing this, yoga, not surprisingly, perhaps a little bit more common in younger populations, but in meditation, you see that the frequency of use is pretty similar across the age spectrum. So many of you have also heard of the term mindfulness, and I want to talk a little bit about what that word means to me, because a lot of times I hear people use this word and I'm not quite sure what they mean by it. Jon Kabat-Zinn really made this word famous, and he defined mindfulness as paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. So this involves bringing our attention and our intention to be right here, right now. Just observing, without judging it as good or bad, but just noticing what's going on. And there are meditative practices that are specifically designed to cultivate this state of awareness. But you can also bring this quality of awareness into daily activities, whether you're washing the dishes or walking the dog or having a conversation with someone. So let me share with you a brief history of how meditation became incorporated into medicine as a therapeutic modality. And I would say it sort of started with this guy, the Maharishi Mahesh Yogi, who came to the US in the 1960s and taught a technique of meditation called TM, or Transcendental Meditation. And he was very interested in meditation as a healthy, non-drug way to experience other states of consciousness and also to improve health. And some of his followers approached then very young Dr. Herbert Benson, who was at Harvard Medical School studying hypertension, high blood pressure. And he brought them into his lab, connected them to a bunch of different sensors, and found that when they sat to do their practices, their heart rate went down, their blood pressure went down, all of these things that we associate with the stress response reversed. And because you couldn't talk about meditation in the medical literature in the 1960s and 70s, he coined this term called the relaxation response to describe the physiology of what he was seeing. And he very soon realized that these changes were not just specific to TM, but there were a variety of different meditation practices that had a similar physiologic effect. A few years later, in the mid-70s, Jon Kabat-Zinn started exploring meditation techniques from a more Zen and Buddhist perspective and founded a center and eventually created an 8-week program called Mindfulness-Based Stress Reduction, or MBSR. And that program has now become widely disseminated, and there's been many offshoots of it. But it's not the only program that is out there. It's though one of the more well-known ones. And the 14th Dalai Lama has also been very instrumental in helping to bring these practices into modern medicine, because he provided Dr. Benson and other early researchers, including Richard Davidson at the University of Wisconsin, access to Tibetan lamas who had been doing these practices for decades, so that they could study them and understand what was happening in the brain and the body as they did these practices, which gave more credence to the potential health benefits of meditation. And then James Gordon founded a center in Washington, D.C. for mind-body medicine. And he's also done a lot to sort of spread this work, particularly working with people who've had traumatic experiences and using mind-body tools, not just meditation, but other parts of these practices to help people heal. So I'm going to focus most of my remarks today on meditation, given our limited time together. But I want to share with you just a few pieces of data about the powerful effects that meditation can have on our physiology. Because what I realize when I talk to patients and also my physician colleagues is that many of them don't realize how profound these practices are. So this is data by one of my former colleagues in Boston, where they took 20 people who'd never meditated before and put them through an 8-week program where they were meditating for 20 minutes a day. They did fMRI scans of their brains before and after this 8-week program, and they also took a similar group of age and gender matched controls and had them have their brains scanned 8 weeks apart, but without learning to meditate. And what they found was that even in as little as 8 weeks of meditation practice, there were changes in the brain that they could see on these MRI scans. Increases in gray matter concentration, that's actual neuronal cell bodies, in the prefrontal cortex in these areas involved in attention and concentration, in the midbrain in areas involved in emotion regulation, and in the posterior brain in areas involved in the release of neurotransmitters like serotonin and dopamine. There have been many studies of meditation looking at changes in the brain with this practice in novices as well as experienced practitioners. And these studies show that meditation increases neural plasticity, that even older adults in their 70s and 80s can have benefit from these practices, and that meditation enhances neural connectivity, how different parts of our brains are connected and wired to each other. There's data that meditation may actually slow brain aging. And so as we age, the cortex, the outer layer of our brain thins. The hippocampus, which is involved in memory, gets smaller. And these are fairly reproducible changes over time. And what these researchers did was that they trained a computer algorithm to estimate somebody's age based on measuring slices of the brain from CT scans. And what you see here in the graph on the left is chronologic age on the x-axis and estimated age on the y-axis. You can see that most of the controls fall along that line. In the graph on the right is a group of long-term meditators, people who've been practicing this for a number of years. And what you see is that this curve is shifted upward, such that by age 50, the brains of the experienced meditators were estimated to be 7.5 years younger than their age and gender matched controls. Now, there may be a few lifestyle things that go along with having a long-term meditation practice that may be confounding some of these results, but there have been similar data shown in other studies, and we now have a better understanding of a potential mechanism for this. So I want to talk a little bit about telomeres. Telomeres are repetitive sequences of DNA that cap the ends of our chromosomes. And as our cells divide, telomeres shorten as we age. But it's also been shown that for people who experience stress, telomeres shorten prematurely, and DNA becomes damaged and the cells become senescent, or they age. And there is data now from several studies that people who engage in meditation regularly increase expression of an enzyme known as telomerase that helps to maintain and protect and heal these telomeres when they become damaged. And telomerase is not the only gene whose expression is changed by meditation practice. In this figure here, this is from a study where they took, again, about 20 different individuals who'd never meditated before in the N1 group, put them through an 8-week program called the SMART program, and then took blood from them again at the end of the program. You see an N2. And what they found comparing N2 to N1 post to pre-program is that there were over 1,500 different genes that were either upregulated or downregulated as a result of meditation practice. And the M group on the far right is a group of long-term meditators for comparison. And so you can see for this set of 25 or so different genes that the N2 group after meditation training looks a lot more like the long-term meditator group than themselves pre-meditation training. And there are a variety of different gene pathways that have been found to be affected. One of these is decreases in genes involved in inflammation. They say improvements in how insulin gets utilized in the cell and in mitochondrial energy production. So I want to talk briefly about conditions and just give you a list of, for examples, of some of the different health conditions that stress can exacerbate and that we now have randomized controlled trial data showing that meditation can improve symptoms in these conditions or improve health outcomes in these conditions. And mental health conditions are one of the big ones. We know that stress can negatively impact these conditions and that regular practice of meditation can improve sleep, can help people with concentration, particularly ADHD, although it's challenging and often in the beginning to learn these practices, that it can improve anxiety and depressive symptoms, PTSD, and may be helpful in addiction as well. There are a number of gastrointestinal conditions that are impacted by stress. The biggest concentration of neurons outside of the brain and spinal cord is in the gastrointestinal system, and so it's very sensitive to stress. And we have data that mind-body practices can be helpful for gastroesophageal reflux, for irritable bowel syndrome, inflammatory bowel disease, and some kinds of chronic abdominal pain. Similarly, these practices can also be very helpful for a variety of different cardiovascular diseases and risk factors: coronary artery disease, high blood pressure, diabetes, some arrhythmias like paroxysmal atrial fibrillation, heart failure, and stroke. And last but not least, a whole range of other health conditions: chronic musculoskeletal pain, a number of autoimmune conditions, headaches, menopausal hot flashes, and even cancer-related symptoms like fatigue and overall quality of life can all be positively impacted by regular meditation practice. Now, this list isn't complete, but just to give you a sense of some of the scope of the research and findings that we have now. And just by way of caution, I don't want meditation to sound like a cure-all. There are some instances in which this may not be the best approach for someone. For example, if I see someone who has very severe depression that they're not motivated to do anything, or very severe anxiety that they can't sit still, meditation is not a good place for them to start. It'll be hard for them to learn these skills and integrate them. So usually I'll have them start with medication and or therapy to help get their condition a little bit better under control so they have some bandwidth to learn these tools. Similarly, if I'm seeing someone with schizophrenia or multiple personality disorder, I myself will not teach these skills because I don't have the psychiatric background to help them. And there is a concern that they could perhaps lose touch with reality more. However, in the hands of someone who has mental health training in these conditions, a psychiatrist or a very good psychologist, these practices may be helpful. And finally, for folks struggling with addiction with really hard substances such as methamphetamine or cocaine, there may be a potential for having some adverse experiences if they try to meditate while they're using these substances. Now, I've talked a lot about the personal health benefits of meditation. I want to talk a little bit about the societal benefits of meditation. There's data that meditation practice can enhance empathy and compassion, pro-social behavior or altruistic behavior towards others, and that may also help decrease implicit age and race bias. Many of our implicit biases emerge out of our stress response, and if we are more calm and centered and more compassionate and altruistic, there's less of an opportunity for those biases to come to the surface. So let me share with you now how I talk with my patients about meditation, how I teach them about meditation. And one of the things that I have noticed in the decade plus doing this work is that there are a lot of common misconceptions about meditation out there. And one of the things I like to tell people is you don't have to twist yourself up like a pretzel. You don't have to chant a strange sounding mantra, though you can if you wish. And it's not about blanking the mind. You cannot blank the mind. You can't turn off the mind like a light switch, much as we might like to do that sometimes. Rather, meditation is about developing awareness and learning how to be more fully present in this moment. The mind is going to wander, and that's normal. In the 25 years that I've been practicing, I haven't blanked my mind yet. My mind still wanders, but I've gotten a lot of benefit nonetheless, and those benefits have just grown over time. So mind wandering doesn't mean you're a bad meditator, it just means you're human. Now, meditation, I tell people, is really just about two things. It's first consciously focusing the mind on something. That could be the breath, or it could be a word or a phrase, or it could be a short passage from a scripture or prayer, if there's a faith that you have a strong connection with. It could be a sound in the environment. It could be an image in your mind. It could even be a physical sensation in the body. But you focus your mind on one of these things. And the second is that when the mind wanders off, which it will do, you bring it back to that focus over and over and over and over again, but without judgment. That's the key, because it's the judging mind that gets in the way. One of the analogies that I like to use is that meditation is like watching leaves floating down a stream. And for many of us, a leaf gets caught behind a rock in an eddy and starts to swirl. And we make up a whole story about this leaf, we identify with it, we define ourselves by it. What meditation helps us to do is to begin to develop the skill of noticing the leaf, but then allowing it to continue to float downstream without getting caught up in the stories around it. Not pushing it away and not ignoring it, but acknowledging its presence and then moving on. Knowing that there's going to be another leaf, and another leaf, and another leaf coming down. Now, meditation can be practiced in a secular context. It can also be practiced in the context of a faith tradition. And so for people who have a strong faith, I encourage them to connect those dots because it can strengthen their practice. But it's certainly not necessary. There are some things that you can do that will help you to go deeper in a meditation practice. And I want to talk a little bit about those. And the first that's really key is getting a good seated position. So you see a few different options here. And what I'm going to say, looking at this young woman here on the left, is don't do this. And the reason is you'll see that as she is sitting, her spine is not upright. She's leaning forward slightly, and her knees are up in the air. And this is going to get really uncomfortable for the hips, having the knees up, uncomfortable for the back and the neck, because you have to hold a lot of tension if you're going to sit upright. And if you're leaning forward, you're also going to have muscle spasms developing there. So instead, as the picture in the middle here, finding a cushion that you can sit on that's going to allow your pelvic bones to slant downward so that your knees can rest supported, and this is a much better position for sitting upright. Or if sitting cross-legged is challenging for you, you can use a meditation bench as shown here on the right, or sitting in a chair is also perfectly fine. And as you see here in this picture, if you don't have an adjustable height chair, you want to get props to help support the body. So if the chair is too tall, putting a cushion under the feet. If the chair is too short, under your sits bones. Because what you want to have, as you see in this woman on the right here, is to have your thighs roughly parallel to the floor or just slightly sloped down to get the optimal ergonomics for sitting upright without holding tension in the body. Typically, I rest my palms upright or folded in the lap. Avoid palms down because it tends to lead to hunching forward. You can use a pillow to support the low back if you have back issues. And finally, most people close the eyes to cut out the visual distraction. But you'll note when you close the eyes that there's a tendency for the gaze to go down. And when that happens, the mind wanders more. A trick that I like to encourage people to use is to keep their gaze slightly lifted, like they're looking out at mountains in the distance behind closed eyes. And that'll help you to stay more focused in your practice. Now, sometimes people ask me about laying down to meditate. And while you can do that, certainly, there is a tendency when doing so to become more subconscious in the practice and to drift off to sleep. And that's fine if you're using the practice to help with falling asleep. But you won't get the cognitive benefits and as much of the stimulation of the prefrontal cortex doing so. So I encourage people to sit upright when they can. So let's do a guided meditation together now. And I'd like to introduce you to two of the most basic meditation practices out there. So just finding a comfortable position as best you can wherever you're seated right now. Allowing the eyes to relax closed if that's comfortable for you. And if you're closing the eyes, gently lifting your gaze. I invite you to take a nice deep breath in through the nose. And a long exhalation out the mouth. And just letting the next breath come in on its own. Breathing naturally in and out of your nose now at your own rate and rhythm. And I invite you to become an observer of your breath. Just noticing the natural rise and fall of the breath in your own body. And gradually bringing your awareness of the breath to watching it as it enters and leaves the nose. And just noticing any sensations there. You may notice the coolness of the air as it rises with the inhalation, and the warmth of the air as it descends and leaves the nose with the exhalation. You may just notice these sensations at the tip of the nose at first. But with time and practice, you can trace them deeper and higher into the nose. And we'll just spend a minute or so watching the breath, noticing the coolness with the inhalation and the warmth with the exhalation. And if you find the mind wander, which is natural for the mind to do, that's okay. Gently lift your gaze behind closed eyes and bring your awareness back to the breath. Noticing the coolness with the inhalation and the warmth with the exhalation. Now we'll transition to a second kind of meditation technique, using a word or phrase as a point of focus. And so choosing a word or phrase that has some uplifting or positive meaning for you. It could be in English or another language. It could be a secular word or phrase. It could come from a faith tradition. And just mentally repeating that with the breath. For example, one that I like to use with the inhalation, silently saying, I am, And with the exhalation, at peace. I am at peace. Just silently repeating that, or whatever word or phrase you've chosen, to the natural rhythm of your own breath. And now just noticing your breath and noticing if it's any different from when we first started. And you can begin to bring your awareness back to your body, sitting in the chair. And with the next couple of breaths, gently opening your eyes. So I invite you to take a moment and to just ask yourself, what did you notice doing this practice? Maybe you noticed nothing. Maybe you felt sleepy. Maybe you found it relaxing or calming. Maybe you noticed a little anxiety or restlessness, or you thought it was pleasant. Or maybe you were thinking about something on your to-do list. Any of these things is valid. The most important thing is that you were aware and that you noticed what was going on for you in that moment. Now, if I've inspired you to take up a regular meditation practice, let me share with you a few tips that I share with my patients. Most of us are creatures of habit, and so finding a time of the day that works for you is really important. A lot of people like to do this first thing in the morning or in the evening before bed, sometimes on their lunch break or time in the afternoon that works well for them. Doing it in the same location at the same time of the day will help you to create a meditation habit. You also want to find a compelling focus to anchor your awareness. It could be the breath, it could be a word or phrase, it could be a combination of the two, or something totally different. Different tools work best for different people, and so I encourage you to experiment and try out different things and do what works for you. Set the bar low in the beginning. Start with 5 minutes, 1 or 2 times a day, and gradually build from there. If 5 minutes feels like too long, start with 2 or 3. The most important thing is to do this every day to get those benefits that we talked about. And then you can gradually grow and build your practice from there. Don't worry about doing it incorrectly or your mind wandering. That's normal to feel that way in the beginning. And just stick with it and keep it up. You'll develop a flow naturally over time. Having a teacher or a group to help support your practice can be really wonderful and help you to go deeper. And the benefits really do increase with regular practice and time. So I encourage you to stick with it. Now, a common question I get is, do meditation apps work? Or what's the best meditation app? And the best app is the one that you find the most helpful for you. There are hundreds of meditation apps out there, and most of them have not been studied, but some of the more common ones that you hear about do have a handful of studies that do seem to show benefits. Apps are a good way to get people started. They're a good way to give people a focus, but they're not going to, generally speaking, take you deep into a practice. So having some interaction with a teacher or someone can be really instrumental for that. But apps can be a really good place to start. If you try an app and you don't like it, or you don't like the voice or how it's working, try a different one, because there's a lot of different variations out there. And as I said, different things work better for different people. Find the tools that work for you. So I've spent a lot of time talking about meditation today. I want to end with just a simple breathing technique. Meditation is a great thing to do, to have as a bookend to your day, for example, to do it at a regular time. It's not so easy to do in the moment when you're stressed, particularly in the beginning. And it's helpful to have other tools to use in the moment. And this is a short breathing technique that I have found and my patients have found very helpful. It's called even count breathing or triangular breathing. The idea is that you inhale, hold the breath, and exhale all for an equal length of time. For example, inhaling to a count of 4, holding the breath for a count of 4, and exhaling for a count of 4. Or it could be 5, 5, 5, or whatever count you like. Just don't hold the breath so long you get short of breath, because that's not relaxing. And if you have uncontrolled high blood pressure or a serious heart condition, you also don't want to do breath holds because that can put extra strain on the heart. So if that's the case for you, keep the inhalation and exhalation of equal length and just do a brief pause in the middle. And doing 3 to 5 rounds of this style of breathing can be very helpful for taking whatever is right here in your face, stressing you out in the moment, and giving you a little bit of distance from it and a little bit more freedom in terms of how you respond. So I invite you to join me as we do this briefly together. You can do this eyes open or eyes closed, doesn't matter. I've done this in the middle of a stressful meeting with my eyes open. Nobody needs to know you're doing it. So just inhaling slowly through the nose. Holding the breath. Exhaling slowly through the nose. Inhaling. Holding. And exhaling. Once more, inhaling. Hold. And exhaling. That's simple. You can do this as many times during the day as you want to, 3 to 5 rounds at a time. Find something to remind you to do this throughout the day. Set a reminder on your smartphone or watch or post-it note on your computer screen, and give yourself little mini doses of this physiology that's the opposite of the stress response, and you'll find that it really is very helpful. So in summary, meditation and related practices have tremendous potential to improve mental and physical health, and I believe also to benefit society at large. And as a physician, I really feel like this should be part of what we call primary prevention, that because we just live in this sea of stress in modern life, we should all be engaging in these tools to help promote our own health and well-being and prevent disease. And we do need some more research on tailoring these tools to individuals, which particular practices work best for which people, under which circumstances. And I really want to just end by saying these are learned practices, they're learned skills. And so it takes time to develop them, and I have found for myself at least that time investment is more than worthwhile. So thank you very much for your attention.